Good afternoon, ladies and gentlemen. My name is Jana Hrstkova. I am the president of Harvard Club, Czech Republic. And I'm also founder and CEO of Keller Williams, Czech Republic. So I would like, first of all, thank you, Daniel Meron, His Excellency, Ambassador of Israel to Czech Republic. And I would really appreciate a few introductory remarks.
Dobre odpoledne, shalom. It's a great pleasure to be here with you this afternoon and talking from my house to all of you here in Prague and outside of Prague. It's a great pleasure to work together with Jana Hrstkova, who is a driving force, not only herself, but also through the Harvard alumni and Keller Williams to bring together this webinar. I would like to say that we are very lucky to have here with us today a really great speaker. Yoav Fisher from HealthIL is the person to talk to us about the combination between technology, science, innovation, and COVID-19. What Israel has to offer is digital tools and technology and experience that we have done in the last 2 months in ways to find solutions for the coronavirus pandemic. Now, there's a great work being done also in the Czech Republic.
I would like to invite our distinguished speaker, Yoav Fisher, to share his views.
The point of this is to kind of talk about digital health and what's going on here in Israel before dealing with the coronavirus, during, which we're now, and maybe what will happen in the future. My hope is to give you kind of a different perspective on it. HealthIL is a digital health ecosystem here in Israel. I work, along with my team, with all of the healthcare stakeholders in Israel, meaning hospitals, HMOs, and corporations who are stakeholders in healthcare. And we lead them on a formalized, challenge-centric, and holistic approach to understanding their needs and challenges, as well as understanding how they work. And then finally, we match those challenges to the most appropriate solution, AKA startups. So on the one hand, I have all the health organizations and corporates. And on the other hand, I have the startups and tech solutions. Right? HealthIL sees digitization as a tool for fostering healthcare innovation, not just in Israel, but also globally. There's also a mismatch between what the startups in Israel are building and the actual needs of healthcare organizations, right? The most oversupplied ones relate to monitoring, indoor navigation, decision support tools, parking optimization, surprisingly, is a major issue in all hospitals, and HR management. So these are challenges where there's actually quite a lot of startups offering solutions, as opposed to the undersupplied, where there's not a lot of startups offering solutions.
I would like to hear example of good practice of digital health in Israel.
IDEC is a company called TytoCare. TytoCare is effectively makes a little box like this, the size of this, where you can plug in various things to it, a thermometer, a stethoscope, whatnot. And it's a remote monitoring tool for GPs, for general practitioners. It can monitor, imagine a mother who's monitoring a child, but there's also a telehealth component. So the mother can take readings of the child, and the doctor doesn't actually have to see the child. They can say, yes, this is good, this is bad, this is whatever. You can come in, you can not come in. Now, why is this interesting for Corona? Because a lot of these things are people who effectively don't need to come in. Yes, they may be symptomatic, but they're not critical. So here's a way to kind of leave them at home where they're probably safer. Another great example of this is a company called Heramed. Heramed does fetal heart rate. It's another dongle. It's about the size of my mouse, and it has sensors on the back. And the mother can put it on her stomach. This is also FDA approved and everything. And it does fetal heart rate monitor, and it can send that to the care provider. This is interesting because of two reasons. First, the mother and her unborn child do not have to come into a hospital setting, which may or may not be infected. But more than that, and especially regarding Corona, is that the nurse who's dealing with the mother can now be allocated toward the ICU. So HealthIL is a really interesting example where it affects both sides, right? The mother doesn't have to come in, and also the nurse can be used for something much more critical, which is really needed right now.
Thank you very much to everyone for attending this event.